Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my producer, Lindsay, and we are streaming live from the Moses Lake Professional Pharmacy Studio. As we do mostly on Mondays, today we are here on our midweek podcast on a Thursday. Always, we are usually Monday, 12:30 to 1:30 Pacific Standard Time. You can see us right here on Facebook. And later on, you can always find us on YouTube, the Moses Lake Professional Pharmacy YouTube channel, because after we are done recording, we put it on YouTube. And so subscribe to our YouTube channel so you don't miss any episodes. Also, check us out on Rumble, Moses Lake Professional Pharmacy on Rumble. And without further ado, I am going to talk a little bit about Grace Brucal. She is a physical therapist all the way over in West Virginia, all the way across the country where it is hot and humid, she tells me, of course, because it is July in West Virginia. And she is a very unique physical therapist, and the fact that she specialized in autism and she is studying functional medicine and physical therapy right now. So I'm familiar with functional medicine when it comes to medications, obviously. We've talked a lot about it on this show, but I'm not familiar with functional medicine when it comes to physical therapy. Now, functional medicine, she can describe a little bit what that is, but functional medicine is how we treat problems. We don't just treat symptoms. And we work with a lot of functional medicine practitioners at Moses Lake Professional Pharmacy because we'd like to fix problems, not just treat symptoms with drugs. So if you follow this long enough, you know that is definitely us. So Grace, without further ado, welcome to our show.
Thank you so much for having me. It's a pleasure to be in the show. I've been following your podcast, and I said, I want to be in that show, and this is it. Thank you so much.
You're welcome. Well, thanks for the kind comments, and I'm glad you wanted to be on our show, and I'm glad we could connect. So I'm excited for our interview.
Yes. Thank you.
So tell us a little bit. So what is a autism specialist in physical therapy?
Well, to begin, I was just, I came from Philippines originally. I migrated here for a better life and job opportunity because way back in the Philippines, it's really hard there. Although we have a lot of training, a lot of studies, we can't find a job. And I can share this that when I was in the Philippines, I get paid $200 for a month. A month. Yes. So a lot of physical therapists coming from Philippines wanted to come here in United States for a good for hoping that it would help them also as well raise their kids here and a better opportunity. So I'm here. So going back to your question, what is physical therapist? Is a physical therapist is we are the one who evaluate and record patients' progress. Physical therapist helps injured or ill people improve and manage pain. They also often important part of the preventive care, rehabilitation, and treatment for patients with chronic condition, illnesses, and injuries. So the being a specialist, so as a physical therapist, you can specialize. Just like a doctor too, you can specialize. We have a doctorate program too. My husband is actually a doctorate in physical therapy. But then I kind of deviate a little bit. I focus more on the kids, pediatric cases. It's a personal why I do that because I have a son with mild autism, and there is not a lot of research on how to treat these kids with autism because it's basically new to all of us. I mean, it's been probably a decade, but we are, as a physical therapist, we are at loss to us, same as the pediatricians, and it's everywhere now, and it's alarming because most of us, like us parents, we are at loss, and knowing that I am a physical therapist and I'm still at loss, I said to myself, this is my calling to educate people and really help these parents find the necessary support, the empowerment because they're at lost, and I am too one time. And so I studied it. I become a specialist. Found I have a good work that helps us to have a continuing education. So I grabbed that opportunity. It was a 2,000 worth course of autism specialist. I grabbed that, and then from there, I applied what I've learned and everything alternative medicine. I try and try all the supplements. I tried all everything just to help my son. And finally, I saw, I understood, and then I slowly applied it to my son, and I saw some progress, and then I got excited, and it opened my world to functional medicine. So that's the reason why I'm enrolled to a functional medicine school right now.
I see. Well, great. Thank you for that. I want to mention two things. You said two things that we repeat on this show constantly. You said you want to educate and you want to empower. And that's what our podcast is all about, is educating and empowering consumers to take charge of their own health. So thank you so much, Grace, for doing that.
So,
So what do you specifically do as an autism specialist or for autism as a physical therapist?
as a specialist in autism, as a physical therapist, so I have a lot of hats. You'll probably be confused. I do fashion show too. But anyway, going back to physical therapy and autism, we focus on treating those kids with autism, with ADHD, or any developmental delay. So let's say autism is just not about decreased focus. They also have a problem with understanding concepts. There are the kids that when you say stop, they won't stop. But when you say run, they won't run. But when you don't say run, they'll run. So that's where our job comes in. That is what we call as like a task segmentation, or we teach the patient or the child to kind of focus, slow down, and then plan. Motor planning, we call it motor planning. And so that's where physical therapy comes in. And I love it because like I have more knowledge in autism, so I understand how they see world. Like kids with autism doesn't get it one time. So as a physical therapist, or even the parents, they have to be really patient. They have to see the world from their perspective. So with therapists or with parents, you have to repeat the cues, and you really have to be patient, and you have to really control your facial expression, because they don't really get it right away. They'll get it, but you have to do it multiple times. So it's really humbling to know all of this.
So what would a typical treatment session look like for an autism patient? I know everybody's unique, but can you give us a general overview?
Yeah, most of these kids with autism, they have a sensory problem as well, or delay. So you typically will see those kids with autism tiptoeing. And then for other patients, like, oh, it's just normal. He just wants to do it. But we have a lot of patients with kids with autism with tiptoeing, like their toes are, looks like you have heels. They're wearing heels, but it's gonna be a problem if we don't correct it, or we don't treat it, because they'll it's gonna be a problem when they run, when they walk. They're gonna be off balance. So that's our concern with as a physical therapist. I'd also want to add that occupational therapist is part of the therapy. They focus more on the cognition, the behavior, the fine skills. Physical therapy focus on the motor skills, the running, the jumping, the balance, the motor planning, and all of those.
I see. So yeah, that's very enlightening to me. I had no idea. So what are some other things that autistic kids might do? I had no idea that they walk on their toes like that. But what are some other things that autistic kids do that a physical therapist might have to correct?
So let me also educate people on when we address When we address kids with autism, we call them first as a person and then the autism. So we call it kids with autism, not autistic kid. So that's general. I also learned that from this training. So we address the person first and then label them. So that we call that kids with autism. So with kids with autism, we have to also know since for physical therapy aspect, I've mentioned about motor planning. Kids with autism doesn't. You have to have a schedule for them because they actually would um, have a meltdown if they don't follow the schedule. You have to really be. They have to list down schedule. They have to visualize it. You know, kids with autism doesn't have or having a hard time with concept. So they don't know about things like if you want them to sit down. A lot of these kids with ADHD, kids with autism, um, they can sit still. So a lot of therapists will have a hard time if they can sit still, especially when they started going to school. They have to sit down. So what I've learned from a special therapist, a speech therapist, is give them a visual cues that they need to sit. Even washing hands, they have to have the visual cues on how to wash their hands one at a time, like one step at a time. And also we also focus on the balance. So those of the kids, they don't have the safety issue. They have issues with safety. They would just run, and then they don't have the safety issues, like if they cross the street. You have to train them on checking if there's cars, and you really have to empower the parents as well, that these are the things that they have a disability or they have a hard time, is to emphasize those. And for us as a therapist, we need to educate these parents that it's okay, it's normal for them to have this and that. And so when you recognize and when we empower those parents having kids with autism, that this is they and them, it's normal for them to have this, it kind of helped them as well, and then
Right.
give them the solution.
Wow, well, that is wonderful. I mean, you are definitely enlightening me about this because I had no idea, and I'm sure that our listeners and viewers will appreciate the information because there is, like you were saying earlier, there's it seems to be there's a big increase in autism, and we
Yes.
may, we think there might be some links we don't really know, but we definitely need to know how to treat these kids with autism. So thank you for that.
You're welcome.
So when it comes to functional medicine, let's move on from autism. And then when it comes to functional medicine and physical therapy, what are some other things that you would treat functional medicine wise in physical therapy?
So you actually can separate the physical therapy practice. I don't practice a functional medicine yet, but knowing this, the functional medicine is the science of why this happened. So it kind of helped me now that I have this knowledge in functional medicine. It have helped me a lot as a physical therapist because now this I can understand why are some of my physical therapists as to I mentioned that we treat patients with pain, with joint pain, with arthritis, with injury, inflammation. So I am so happy because I understand now why are my patients in physical therapy not improving, like not 100% really healing. That is because we lack the nutrition part. We physical therapists, we are not trained to really, we did not study the absorption, the nutrition, the importance of food to heal. We didn't study that. Now that I have that knowledge, eventually I educate my patient on what to avoid, what to focus on as to food, as to nutrition, and it have helped my patient, and they are amazed. And I love my patients because they listen to me. They, let's just for instance, Like, what are those inflammatory foods? Like, say, oil, for instance, the canola oil, the vegetable oil. No, not a lot of people knows that those are inflammatory oils. So I would tell them, okay, instead of that, you use coconut oil. So, and I was amazed because it have helped my patient, and physical therapist like, oh, you know what? I have less pain once I tried what you told me, what to eat, what not to eat, and I love it because it's helping my patient holistically. Yes, it's interesting.
I love it too. And, you were speaking right up our alley. We discuss this all the time on our podcast. And really, there's three things that we can do to stay healthy, and
Yeah.
that's sleep, that's eat, and that's exercise.
Mm-hmm.
And of course, when it comes to movement, you already talked about it. Physical therapists are all about motion for sure. I mean, you guys know how to make things move and make a body move for sure. And but the reality of it is that the most important part is sleep,
Mm-hmm.
because
Sleep.
we will die without sleep before we'll die without food. That's just true. And then secondly, the second most important part would be nutrition, and exercise is third, actually. So
Mm-hmm.
nutrition is so important because, like you said, there's so many inflammatory foods and anti-inflammatory foods. So, there's many patients with joint disease. We had a orthopedic surgeon who, I'm sure you've worked with a lot of orthopedic surgeons over the years, and he actually started talking to people about going keto.
Mm-hmm.
And a lot of the patients that went keto, they didn't need surgery anymore. They lost weight, and because of the anti-inflammatory diet and losing weight, they didn't need surgery anymore.
Yeah, when you talk about that, I remember when I was doing podcasts because I actually got inspired by you, one of the hosts, and I said I can do this too. Instead of me tell, okay, get me as a speaker, I can also host like you. So I started my podcast March when I feel that I have something to share, and I know a lot of people. I'm in a networking business, so I said I started it, and then I interviewed a doctor that actually changed it really improved my knowledge on low carb. He is more of low carb fasting, so kind of keto is more strict, like trying
Mm-hmm.
to carbs, but this one is low carb fasting. So she's from a doctor from Philippines. Her name is Dr. Rojas. She's very influential there. So I kind of followed and interviewed her and then practiced. And I said, wow, this is amazing. I lost a lot of weight, like 20 pounds in 2 months. That's never happened. And so when I understood it, and he has this master class, I enrolled without doubt. And now I'm certified low carb fasting coach.
Oh, well, good for you. Congratulations.
Yes. So I know, and now I can connect the dots of why are we getting inflamed. That's from our food, from the chemicals, from the metals that we put, and that's the one that I actually did to my son to improve his function. Is to really understand why are these kids having ADHD, why are these kids having autism, and with that knowledge, you cannot really help people or heal people without understanding the root cause of most of the diseases. And that's why I studied functional medicine, because I am really thirst of why is it happening. Because once you know the root cause of it, you will actually help that patient, because you get to the root cause of it. And with that, if there's toxicity with these kids with autism, you have to know the proper detoxification, the proper elimination diet. So with autism, we that's the reason why you hear this gluten, non-gluten, gluten food would inflame their kids. And there's also what we call a gut connection, brain and
Mm-hmm.
gut connection. So I study that, and I said, and then the microbes, and it's amazing journey that when I understood it. And also I've learned the nutrigenomics, that is the study of the nutrition on your genes, and apply that product to my son, and it's amazing, an amazing improvement. And when I saw that this is my call, that's why I brave myself. I'm really shy with lives. I can't even do a simple live, but since this is my call, I said, this is my call. I know why you give a son with autism, and I know why you give me the skills and this amazing opportunity to talk to people and just educate and empower these people, especially those parents. It's hard. It's hard to be given in a situation when your doctor or pediatrician diagnose your son or your kid with autism. It's like end of the world. But the emotion, the denial period, it's really hard because, as I've said to other therapists, we parents with kids with autism, ADHD, or any disability, we need therapy too, because emotionally
Mhm.
it's hard. I'm a therapist, I'm a strong-willed, woman, mom, but I still get defeated. you know so being said that, I want to educate. My call is to educate these parents, that tell them it's okay, come down, face the problem. It's not about you, it's about them. Let's help them. Set aside your emotion. It's okay to cry, but let's work. Let's work. Let's focus on the kid. It's not about you, it's about the kid. Let's help that kid. So that's my role in life.
Well, and having a personal experience with that helps so much, and you can relate to those parents of kids with autism. So, they must get great comfort in that, knowing that. So I am glad that you look at your calling and you are moving forward with that. So thank you for doing that.
You're welcome. It's my pleasure, and it's really it's hard at first, but God is showing me the way, giving or giving like ways to how to do it. Like right now, I'm on your podcast.
Yeah, thank you.
For listening. So this is a big help. Thank you for doing this.
You're welcome. Thanks for being on. And so what's the future hold for you? You want to get this functional medicine study done, and then where do you go with that?
Well, I plan to practice as a specialist in autism and help these kids, because having just the autism and ADHD, it's overwhelming already. There's, according to the studies in 1999, few years ago, it was the ratio is just 1 to 20,000 or 10,000. Did you know in 2020 it's 1 to 68?
Wow.
So just imagine. So I want to practice focusing more on autism, ADHD, and helping them holistically, and helping educate these parents. I don't know how, but I'm going there and create my own practice.
So I think you've made it pretty clear what your passion is, but if you will go ahead and just share that with us, what do you have a passion for? I think it's obvious, but go ahead and share that with us.
Yeah, my passion is just to basically help people, educate people. Because I used to be a professor in physical therapy, one of the best school in the Philippines. I love it. I love helping therapists, helping people become a therapist. But you know, I've. It's just like when you open your world, it's just not about just physical therapists. There's more out there. So I want to encourage those physical therapists as well to focus more on functional medicine, to really see their patient as a whole. That's just joint pain, just that's just there's a lot. And also be an influencer to not only to people but to trainers as well, to continue not to stop learning, um, to parents not to stop learning and fighting and looking for an answer, and not depend on the doctors that tells you, or there's no cure. Because a lot of these books before, when I read, and I've encountered one pediatrician that I asked, that's the reason why I said, okay, you can't help me, then I help myself, I help my son. So because most of this pediatrician, especially the old pediatrician, they were trained that by the book that autism doesn't have a cure. Okay, so now I would say I can say it's a cure, but there's a way to help these kids improve by focusing on their diet, by focusing on detoxification, by focusing on the elimination diet, and really focusing on what is really causing, on why are these kids having that and that. So it's mostly being aware of what we put in our kids' body. And so I would not detail that one, but just focusing on eating whole food, um, teaching parents how to really cook really healthy food. Not just going to McDonald's and feed them with, French fries and burgers, because actually those are the things that we have to really be open minded, or really open our eyes. Is the food that we're giving our kids are the one destroying them.
Absolutely, absolutely, and thank you for sharing that. So, you have a website called Flip Your Switch with Grace, correct?
Yes, Flip Your Switch with Grace. So I just started just, having a group, and I get inspired, and now I have podcasts. So I've been interviewing a lot, and I want to interview you too as well, and invite. But from this podcast, I got invited to a big group. It's like an international global TV with 200,000 followers from all over the world. So
Congratulations.
yeah, so I am so honored to be on that show. They asked me to be one of the moderators. So whenever I have live StreamYard, a lot of people, I'm reaching out, Hong Kong, Indonesia. It's amazing that people are reaching out to me. I even have one mom from Turkey having kids with autism. So it's overwhelming, but I'm so happy. I'm so happy that finally it's happening.
So, what's the best way for people to get a hold of you if they have questions?
So they can actually message me in Grace Steadfast. It's my Facebook. And just go to flipyourswitch.com. I have a lot of groups. I have groups for parents who wants to lose weight, because I believe, in treating these kids with autism, we have to also take care of the mom. Most of this mom, they gain weight, they're so stressed. So they need to take care of themselves the way I did to myself. So when you have less weight on you, less inflammation, your brain functions well. And so when your brain functions well, you are not going to be hateful to treat, the kids with autism. You are more at peace. And so you are giving a quality care to your kids.
That's right. That's absolutely right. Well, thank you for that. You have definitely achieved our goal of our podcast, which is to educate and empower consumers to take charge of their own health. So I appreciate you being on, Grace. Let's stay in touch. So when you get your functional medicine certification, we would like to have you back on and see some of the neat things that you're doing to shake up lives and to change lives. We would really appreciate that.
Thank you so much. It's a pleasure.
And you've been listening to Health Solutions with Shawn and Janet Needham. Tune in Tuesday, actually. We will not have a podcast Monday. Tuesday, 7:30 to 8:30 Pacific Standard Time, we will have Dr. Vance Lassie on. And he is a doctor who has a weight loss story, his own personal story, and how it's changed his patients' lives. Because you know how we talk on our podcast about, and Grace was just talking about it, how she lost some weight to take care of herself so she could take care of her son and her patients. So we think that is very, very important when, as a healthcare provider, that we take care of ourselves first before we can take care of our patients. So stay tuned, Dr. Vance Lassie, 7:30 to 8:30 Tuesday, Pacific Standard Time. So stay tuned. And thank you for listening to Health Solutions with Shawn and Janet Needham. We will talk to you and see you later. Thank you.